There's two basic type of public benefits that we're going to talk about today, and they're in two different groupings. One is SSDI and Medicare. SSDI is the income stream that goes along with the Medicare benefit. Now, a lot of people think the only way you can get on SSDI or Medicare is by being over the age of 65. That's not true. Someone can be on Medicare as young as 19 years old upon their own accord. How that happens is you have to be an insured worker. In other words, you have to pay into the system for a specific amount of time, which changes based on what your age is. In general speaking, you have to have worked 5 of the last 10 years as a documented worker. If that happens, and an accident happens to you, or you become disabled, you qualify for disability. And how you qualify for disability is by actually working those proper amount of quarters. Something happens to you today, you would apply for disability if you are indeed disabled. Once you apply, the government has a specific amount of time that they have to respond to you. Once you respond, you'll more than likely be denied the first time. You then have 30 days to respond to their denial. If you're fortunate enough to get through the second time, that means you've been hurt, you've applied, you've been denied, you appealed, you now are granted disability. Once you're granted disability, 6 months after that period of time, the individual will start to receive an SSD check. And in today's world, the SSD check is going to come to you on a Wednesday in accordance with when your birthday is in that calendar month. So I'm disabled today, when I start to get disability, it's going to be 6 months down the road, and I'll get my first SSD check. Once I get that SSD check, Medicare then kicks in 24 months after you get that first check. So there's a lot of times you're going to hear lawyers talk about 30 months, 30 months, 30 months. Those are where your 30 months come from. 6 months of waiting to get the first check, 24 months after that, now Medicare kicks in. SSDI and Medicare are benefits that you've earned. You've paid into the system, so therefore you've been deemed disabled, then you start to receive those benefits. The alternative to that is SSI and Medicaid. SSI and Medicaid are means-tested programs. You are still disabled just like the individual on SSD, but you have not worked the proper amount of work orders. When that happens, you can't qualify for SSD and you have SSI. In most states, SSI is capped at $733 a month. That's all the income you can have. But the advantage to that is this: you do not have to wait an additional 24 months to have Medicaid kick in. SSI and Medicaid in most states kick in at the same time, and therefore there's no waiting. Some people say, can I have both benefits? And you can. If you haven't worked the proper amount of quarters or you're a little bit short, you can be on SSI and Medicaid and potentially purchase the quarters to get SSD. If you've paid into the system, you are an insured worker, but your SSD is less than $733, you would get both benefits to have a maximum income of $733 a month, but you would also get both health benefits of having Medicaid and Medicare.